All right, let's dive in. Today, we're tackling something really foundational in clinical research, the experimental group. Especially if you're thinking about becoming a CRA, this is a concept you'll need to know inside and out.
You got it. It's kind of the heart of the whole research process. You can't really understand clinical research without understanding experimental groups.
Okay, so let's break it down. We have all this research, these new drugs or treatments that scientists are testing. Where does this experimental group come in?
Well, imagine you're trying to improve your favorite cake recipe, right? You have a hunch that a new ingredient will take it to the next level. So you bake two batches, one with your usual recipe and another with the new secret ingredient.
So are you saying the people in the experimental group are like those cakes, the ones getting the new ingredient, that potential game changer?
Exactly. They're the ones getting that new treatment. But here's the catch. You wouldn't just bake that experimental batch and automatically assume it's better just because it's different, right?
You'd need to compare it to something,
hmm
like that original batch, the one without the new ingredient, to see if there's a real difference.
Exactly. That's the control group. Without them, we can't tell if any improvements are actually due to that new treatment or just pure chance.
So just watching what happens to the experimental group isn't enough. It's the comparison that gives the data meaning and tells us if that new drug or therapy actually does anything.
Absolutely. Think about a study for a new blood pressure medication. The experimental group gets the new drug, while the control group gets either a placebo or the standard treatment that already exists. By comparing how their blood pressure changes over time, researchers can figure out if the new drug is truly effective.
Makes sense.
Yeah.
Our sources really stress that this comparison is at the core of clinical research. But I'm guessing it's not as simple as just splitting people into two random groups, right? There must be a lot of thought that goes into making sure it's a fair comparison.
You're absolutely right. One of the most important things is something called randomization.
Randomization.
Yeah, it's basically like shuffling a deck of cards before dealing them out. You want to ensure the groups are as similar as possible in every other way except for the actual treatment they're getting.
So it's not just about who wants to be in which group. It's about creating a level playing field so that any changes we see are because of the treatment itself, not other factors.
Exactly. Say we're testing a new workout program. If people get to choose their group, you might end up with all the super fit people in the experimental group, which would mess up the results. Randomization helps avoid that.
That makes a lot of sense. But what about the people actually running the research? Couldn't their own biases sneak in, even if they don't mean to?
That's where blinding comes in.
Blinding.
Yeah, it's kind of like judging a singing competition where the singers are behind a screen. You're judging them purely on their voice, not how they look or anything else.
So in a blinded study, even the researchers might not know who's getting the real treatment and who's getting a placebo or the standard treatment.
Exactly. It's all about removing as much bias as possible from both sides, the participants and the researchers, so the results are as objective and reliable as possible.
Fascinating. It sounds like blinding is all about making things as fair and unbiased as possible.
Absolutely. It's key to keeping the research honest, you know? And this is where things get super relevant, especially for anyone dreaming of being a CRA.
Oh, I was just about to say, this is where things get really interesting for our listeners who are thinking about that CRA career path.
Imagine yourself as a CRA on the front lines of a clinical trial. You're not just watching from the sidelines, you're actively involved in making sure everything is done right, from how participants are chosen and randomized to how data is collected. And it all has to be ethical, of course.
So knowing about experimental groups isn't just a theory thing for a CRA, it's part of their daily job.
100%. CRAs are like the guardians of the study, making sure those experimental and control groups are managed correctly, minimizing biases, and making sure the data is accurate.
It's starting to sound like if you want to be a CRA, understanding the ins and outs of experimental groups is non-negotiable.
You got it. It's really the foundation for everything a CRA does. And speaking of foundations, let's talk about the ethical side of things. We've talked about fairness in research, but it's also about treating the participants with respect.
You're talking about informed consent, right?
Exactly. Before anyone can join a trial, they have to know all about it. What's involved, the risks, the benefits, their right to leave at any time. And this is especially critical for the experimental group because they could be exposed to a brand new, untested treatment.
So it's more than just randomly putting people in groups. It's about making sure they understand what they're signing up for and making an informed choice.
Right. And that's another important area where CRAs play a role. They often help explain the study to potential participants and make sure informed consent is done right.
It sounds like being a CRA involves a lot of ethical considerations, not just scientific ones.
Absolutely. It's about balancing scientific integrity with the well-being of the participants.
Wow, this is all really insightful. It really highlights how much goes into clinical research and that crucial role of the experimental group.
It's a fascinating field, and the work CRAs do is essential for advancing medical knowledge and improving patient care.
Speaking of CRAs, I think our listeners are starting to see why understanding these concepts is so essential for their future career.
Yeah, I'd say it's non-negotiable. If you're going to be responsible for these clinical trials, you need to be fluent in experimental design.
Well said. And on that note, I think we've given our listener a solid foundation to understand this fundamental concept. But before we move on, I have a question that just came to mind. Remember that cake analogy? What if you changed more than one thing in that experimental cake recipe? Say you added a secret ingredient in a 8E, used a different kind of flour.
Ah, great question. You've just touched upon one of the golden rules of experimental design, controlling variables. You really only want to change one thing, that thing you're interested in studying between your groups.
So in our cake example, to know if the new ingredient was the real difference maker, you'd have to keep everything else exactly the same.
Precisely. If you change multiple things, it's like trying to solve a puzzle with missing pieces. You can't tell which change caused the results you observe.
So taking that back to clinical trials, researchers need to be super careful about controlling all those other factors that could influence the outcome, right?
Yeah, absolutely. They control for as much as possible. Things like age, gender, lifestyle, other medications people might be taking, and so on. The goal is to pinpoint the effect of the treatment and nothing else.
That sounds incredibly challenging.
It is, and that's why designing and running these trials is such a complex and rigorous process. But it's also why that experimental group is so critical. It's the key to figuring out whether a new treatment truly works.
This conversation has been eye-opening. It shows how much goes into clinical research and how vital the role of the experimental group is.
It's a fascinating world, and the work CRAs do is truly essential for advancing medical knowledge and ultimately improving how we care for patients.
Well, we've covered a lot today, from the basics of what an experimental group is to why it's so crucial, to the ethical side of choosing participants.
And we touched on the importance of CRAs in making sure these trials are run with integrity and ethically.
It's been an incredible journey. I think we've given our listener a strong understanding of this essential concept.
I agree, and hopefully it's made everyone even more curious about clinical research.
Totally. Before we wrap up, I want to leave everyone with something to think about. We've been talking about controlling variables in research to see the treatment's real effect. But what about those things you just can't control?
You mean like a person's genes or their lifestyle or even stuff in their environment?
Exactly. How do those uncontrollable factors maybe change the results in that experimental group? And what does that mean for understanding the whole trial? It's something to chew on, right?
That is a fantastic question. It really gets at the heart of what makes clinical research so challenging and complex.
So true. Well, that's it for our deep dive today. Thank you so much to everyone for joining us as we explored the experimental group.
It's been a pleasure.
I hope this has been enlightening for you all, maybe even sparked a passion for clinical research.
And who knows, maybe you'll be on a future episode with us as you start your journey as a CRA.
Until then, keep exploring, keep learning, and keep those great questions coming. We'll see you on the next deep dive.
It's like you said, even with the best research design, you can't control everything.
Yeah, that's true.
It just makes figuring out those results even more complicated.
For sure, and it shows why clinical research is always changing. We're constantly learning, getting better at what we do, and trying to understand how these things we can't control affect the outcomes.
Which brings us back to CRAs. Being right there, seeing those little details, and making sure the data is solid.
It's like being a detective, putting all the pieces together.
Yeah.
You need the big picture and those tiny details that can make a big difference. This deep dive has been amazing for me. I feel like I really get it now, not just about the experimental group, but all the things you have to think about in clinical research.
It's where science meets compassion. That's what makes it so interesting.
Well said. So, to everyone listening, I hope this exploration into the experimental group was as helpful for you as it was for me.
Yeah.
If you're thinking about becoming a CRA, keep digging deeper, keep asking questions, and remember, this is just the beginning of an amazing journey.
And who knows, maybe someday you'll be leading your own research, making discoveries that change the world.
Until then, keep those brains working and stay curious. Thanks for joining us on the deep dive.